Today, I am super excited to introduce you to the woman I call my hormone guru. She is the owner of Essential Health in Madison, Wisconsin. Her name is Karen Hansen. But first, I want to give you a very quick update for those of you who are following my HCG diet. Karen also helps me with this. I am on day 23 and have lost 20.5 pounds. I feel like I'm doing really good, being very strict with the diet this time compared to last. I am seeing the change in my body. My clothes are fitting much looser. I'm feeling really good and energized to keep going on the HCG journey. Once the 30 days concludes, then I'll transition into like a 1,200 to 1,500 calorie per day diet. So I'll go up from the 500 calories and probably, depending on what Karen thinks, do another round of HCG somewhere down the road, because I do have some more fat I can lose, and we'll talk to Karen a little bit more about that when we bring her on the show. So, hey Karen.
Hi.
Can you hear me okay?
Yes, I can.
Okay, thanks so much for being here today.
Sure.
Yeah, so I'm hoping that you can start out. I'll just tell everybody really quick how I found you. So years ago, I felt like I was having some issues with estrogen dominance. You probably remember, I think it's been about 8 or 9 years ago since we first met. Does that sound about right? Have you had your practice that long?
It's been almost 7, so probably about
7 well, so it must have been around 7.
Yeah.
I was researching estrogen dominance, and I was having some uterine fibroids and whatever. In the process of research, I came across your webpage. So for those of you who are interested, it's essentialhealthllc.com. I'll bring that up later in the show so you guys can jot it down if you want, and I'll link it in the show notes as well. But I immediately called and made an appointment and went and saw Karen. And it really opened up a whole new world of understanding what bioidentical hormones could do. And it's really been life-changing for me. So I'm going to have her speak onto some of the things that I've learned from her over the years. But yeah, could you tell us a little bit about your background, Karen, and how you came to open your practice?
Sure. It's kind of a long story, but my mother had a hysterectomy when she was probably 33, 34, and was not given any hormones. And we just kind of watched her fall apart in front of our eyes. And as kids, that was very stressful. And I remember feeling angry that nobody was really taking care of her after. And so finally somebody put her on hormones. She became herself again. And that was always a frustration for me, seeing how women are not cared for completely. Mm-hmm. Take the uterus out and the ovaries, okay, go live your life. But that's an overnight change. Overnight, she was in menopause.
Yeah.
And so that changes so many things. So years later, got my nursing degree, got into labor and delivery, thought for sure I was going to be a midwife, and then realized I really want to help women of all ages, not just pregnancy and childbirth. Mm-hmm. So got my nurse practitioner in women's health, got into women's health. Then the women were like, can you help my husband? So then I've been doing additional studies in men's health. And so here I am with my practice.
It's awesome.
Yeah.
And I know, when we started our relationship, me coming to see you, that was before I had my hysterectomy. And then I unexpectedly had that hysterectomy. So I was so glad that I had already gotten to know you, because that is a scary time when all of a sudden you're without hormones. You wonder how that's going to affect your life and your wellness and your future. So I think you were the first person when I got home from the hospital. I emailed you and said, I need to get in to see you ASAP, because I'm afraid what's going to happen as all these hormones just start to plummet.
Yep.
So one of the biggest things, and we talked about this before we got on live, that I hear about over and over from women is that, well, I can't do hormone therapy. I can't do bioidentical hormones because there's cancer in my family. And so many women are under the assumption that estrogen leads to cancer. So I was hoping you could kind of speak on that a little bit.
Sure. So unfortunately, a lot of that misinformation comes from the Women's Health Initiative study that was published in 2002. And it really became a media shit show. And it really did a disfavor to a lot of women. I think the Public Health Journal in 2013 said it has probably caused up to 90,000 women to die prematurely. And what that study was looking at was not what hormones did for menopause. So to be included in that study, you had to be past menopause. You couldn't have any symptoms of menopause because they didn't want you to know if you were on placebo or not. And so they were taking these women who were in their 60s and putting them on hormones, and they were synthetic oral hormones. Adverse effects if you've been 20 years past menopause and then suddenly put on these hormones. And part of that is because as we lose estrogen, our blood vessels and heart vessels lose that elasticity that estrogen gives us, that advantage over men. And so if you've gone 20 years with no hormones, you've lost a lot of elasticity in your heart vessels and blood vessels. And so you're going to see more cardiac events. What the study was looking at was, does hormones help Alzheimer's, heart disease, colon cancer, osteoporosis, all of those things? But what came out of in the media was hormones cause cancer, get off hormones. But the actual study, the women who were on estrogen only actually had 5 less cases of breast cancer per 100,000 people. It was when they added the synthetic progesterone, which is called progestin, that they had 8 more cases of breast cancer per 10,000 or per 100,000. And so that halted the study, and that's where that all came from. Multiple studies since then have shown that if you're starting hormones when you're going through menopause and having symptoms, you actually will age better, have less aging diseases, and live longer than women who don't do any hormone therapy. And Finland in 2015 published a 15-year study following women for 15 years on hormones, saw no increase in breast cancer. And of course, in Europe, they don't use the synthetic hormones that's typically used in America. They use more bioidentical. And bioidentical just means that it's hormonally structured to be identical to the estrogen you make as a human female, the progesterone you make as a human female. So your body can't decipher the difference between the two.
Mm-hmm. So is what women get that are going to their general doctors and they're asking for hormone replacement, is it the same as what you would prescribe, or is it something different?
Typically not. So a lot of, I would say, I don't know what the percentage is, but by far the majority of hormones used in the US still is Premarin or Prempro. And Premarin is basically hormones derived from pregnant horse urine. So very different than our estrogen. There's a few options that are more bioidentical, like the transdermal patch or a gel. But typically I'm using compounded hormones that are made from plants, and then they're identical to what your body makes.
So using my case as an example, because the first I learned of this option was through you, is that I do the pellets of, I do testosterone and estrogen. Now, one of the interesting things that you taught me, and you can expand on this, and I had no clue how, obviously women have a little bit of testosterone, not nearly the same amount as men, but I had no idea the benefits of testosterone in women in terms of, you had mentioned there's a study that indicates it protects us from some dementia or Alzheimer's. Is that right?
Yeah, I think there's been 3 studies now. Our brain has receptor sites for testosterone. And so when we lose it, not only is it just dementia and Alzheimer's, but it's like sharp thinking, word recall, motivation, creative drive, that starts to fade. But yes, studies found that women who have lower testosterone have a higher risk of dementia and Alzheimer's.
Yeah, that's fascinating. And so now one of the things that we had talked about, and you did touch on it, but the benefit of estrogen to our brain and our heart over time. Now you mentioned the elasticity of blood vessels or whatnot. Are there more things that people need to know about in that, from that perspective?
Yeah, well, I think, probably heart disease is probably the most deadly for women. I was trying to look at this statistic. But I think like women who use hormones, it decreases their risk of heart disease by at least 30%.
Yeah.
And as we all know, once women go through menopause, that's when we start catching up to men with heart disease, heart attacks, and that type of thing. And women don't survive as well if they have a heart attack.
Right.
So the brain protection also is really important. So even in that Finnish study, when they studied the women on hormones for 15 years, even just 2 years after stopping hormones, they already saw cardiac inflammation and brain changes. So they're even considering using estrogen, low-dose estrogen in men with dementia to help protect the brain.
So talking a little bit about aging in terms of our physical appearance as we go through menopause and perimenopause into menopause, you know, I talked to a lot of women that said, you know, I really started to see the change in my aging physically in terms of my appearance once I went through menopause. And then I read a study recently that suggested that 30% of our elastin and collagen and elastin is reduced 5 years post-menopause. Is that true? And what can we do to combat that?
Yes, that's true. It's a process. So, you know, we start to lose testosterone late 30s, early 40s. And testosterone is a good collagen builder. But when you start to lose testosterone, you still have some estrogen, progesterone. So you're not noticing the dramatic change. Estrogen is really great for hair, skin, preventing fine lines and wrinkles. And so when that drops, women will really notice, like, oh my goodness, I'm getting crepey skin, that thin old person skin, saggier skin. And then also paired with that is when our hormones start to drop, collagen will rise, and that is great at destroying collagen.
Yeah.
Did I say collagen? Cortisol rises.
Cortisol rises, which we found, I discovered through seeing Karen that I had high cortisol levels. So, which, now correct me if I'm wrong, Karen, will cause you to gain fat in your tummy if you have high cortisol.
Yep.
So I would not know.
Books and blogs about the cortisol belly, and it's a basic survival instinct. Basically, cortisol's role in the body is to handle stress, deal with the fight or flight, adrenaline rush. And so if it's constantly getting a stimulus and your body thinks you're chronically in fight or flight, it wants to conserve energy, which is storing fat. And it loves to store it around the midsection or areas where it's hard to lose it so you can survive longer.
And so why is it also, you know, like, let's just take away the high cortisol levels that cause some of that weight gain around the tummy. Why is it that through perimenopause and menopause that as our hormones start to change that we start to gain more weight in the midsection? Because that's definitely something since my hysterectomy that I've noticed is I do gain weight in the midsection more.
Yeah. So besides the cortisol, we know, so when we start to lose testosterone, we can't build muscle like we used to. And so the body tends to then, instead of build muscle, store more fat. And now we know estrogen plays a role in preventing belly fat. And so there was a small, interesting study in mice where as they dropped their estrogen, they gained more belly fat. When they raised their estrogen, they lost the belly fat. Yeah. So and it's all about hormone balance. It's not like one specific hormone.
Right.
It's all be balanced.
Right. We do have a question here from Jill, and I know she's been really excited to come on and hear what you have to say. How does she determine what hormones to use for each individual person? Does she do blood work to check levels?
Yes, I definitely do blood work. Not that I'm like obsessed about the specific number, but it gives me a general idea of what's off balance, what hormones are too far off balance, and what we need to do. And then it's just really individual. You know, I'm completely comfortable with estrogen. I've read all the research, but if somebody's really not comfortable with it, okay, so let's work with testosterone and progesterone. Let's balance your adrenals and all of that stuff. So it's really individual what their comfort level is, because I always say, if you take something and every time you take it, you think this is bad for me, it's bad for you. So, and it's also just symptomatic. So if somebody's, you know, melting down with hot flashes 20 times a day, estrogen is going to shut that off. So whether we do that short term or long term, but at least to get that quality of life back, that comfort, that balance.
So Jill had another question here, and I think you probably hear this from a lot of your patients. Does insurance cover bioidenticals?
Some will, depends on your insurance plan. A lot of insurance plans will have a specific pharmacy they want to work with for bioidenticals. And like I said, there are now a few options that we can use at any pharmacy. There's one bioidentical progesterone. There's 2 or 3 different bioidentical estrogens that we can use. There's nothing for testosterone for women on the market, so we do have to compound that for sure.
So I know from my experience in the years that I've been seeing you, Karen, is that, you know, some of the things that I've had compound in my insurance picked up some of it, and some of it was out of pocket for me. But one of the things that I found is that it's just worth it to me to feel better, to pay out of pocket. I know at one point we were doing the estrogen patch, which my insurance did cover, and I could get it at Walgreens where I would pick up my other prescriptions. But then once I switched, and I had a hard time switching to the pellets because it was completely out of pocket, but I felt so much better that it was worth spending the money on it.
Right.
So, I mean, there's that aspect of it too, because, you know, I was like, well, if my insurance is going to pick it up, I'm going to go and get the patches. But having tried the hormone pellets, it was just a game changer for me.
Right.
So let's see here. Angela is asking, do you need a referral to see you?
No, I'm a private cash practice, so you just have to call.
Yeah.
Yeah.
And I'll make sure you guys have all of her information. And then when you reach out to Karen, they can let you know like what it costs for an office visit and consultation. And, you know, really, I thought it was going to be a lot more expensive than it was. I think you're very affordable for what you offer, Karen. And then Lori says, I live in Arizona, but would love to have video or phone appointments. Do you do that?
Yes. I would say maybe 20% of my practice is somebody I've never really met face to face. I mean, other than video chat and everything, but yeah.
Yeah, and that's what I love about it is that you can serve your clients.
Right. And
just
so what we
internet.
do in that situation is like we find a lab near them that they can take a lab order in, get the labs run, and then we can review the labs together and just work that way.
Mm-hmm. So now Jill asks, I'm in Milwaukee. Does she do Saturdays?
I do. Not
every
Saturday. Yeah.
Wow. I didn't know that.
Yeah.
I was just going to say to Jill that she might want to try to get you by email or like a Zoom conference or something. But yes, she does Saturdays. That's amazing.
I do. Yeah. I have a big population from Illinois, so I do at least one Saturday a month.
Okay, great. And I know it takes a little while to get in with you. How far are you booking out right now?
I think it's February.
Yeah.
But I do have a cancel list, and people do cancel. So if you're on the list and we call you and you can make it, then it works.
Is it easier for you to work people in if they want to do like a Zoom appointment, or when you meet somebody for the first time, would you prefer them to be in person if possible?
If possible, I think it's nice just so we see how we connect and talk about things. Sometimes I think the second visit's more important to be in person because we're really like, here's your numbers, here's where you should be for optimal health, here's where you are. Sometimes that's harder to do on the phone if people are very unfamiliar with hormones or cortisol or thyroid, and but we make it work.
So one of the things I wanted to touch on, because some of these ladies who have had some questions have been following my HCG diet. Now, the very first time I did it with you, I did the lozenges under the tongue or troches. And then this time I'm doing the injections, which are super easy to do at home. And I do feel like these are more effective in terms of I don't feel hungry. Maybe some of that's just because I'm eating so few calories that my body's adapted. Possibly the HCG is, kind of curbing my hunger. But I get so many comments about how those 500 calories a day have to be destroying my metabolism. Because I work with women, everybody has a little bit of feedback in my office about it, that it must be destroying my metabolism or all of these horrible things. So I was hoping you could kind of speak on the HCG diet and how it works and what the philosophy is.
Yeah. So HCG diet actually is usually done incorrectly. It's a diet that Dr. Simeon came up with in the 1950s, and it really was designed to be the last reset you do after you've rebalanced hormones or whatever's off balance in your body, adrenal, stress, thyroid. And so it was very, very popular, 7-10 years ago. And anybody could walk off the street, pay this clinic to do HCG, lose the weight, but it would come right back. But when done correctly, it is designed to be a metabolism reset, to reset your hypothalamus's body weight set point, or the weight your brain thinks you need to weigh. And as you have cortisol stress and hormone imbalance, your brain thinks, oh, she needs to weigh more. And so your hypothalamus sets a new weight, and the HCG will reset that. So HCG's role is to burn stored fat and build muscle. So while your purpose of you eating the low calorie is to force your body to have to burn your stored fat for energy. So the HCG is going to burn about 2,000 calories of your stored fat. So your body's getting fed those 2,000 calories. When they studied it, 90% of the weight you lose on HCG is just fat. So you're holding muscle but losing most fat. So you actually end the diet with a higher metabolism because you have a better fat to muscle ratio. And then as long as you hold that weight stable within 2 pounds for 6 weeks after, then your hypothalamus resets down to that weight. You might not be happy with that weight, but at least you're not going to be fighting your brain trying to go back to the original weight. Then if you want to work on lowering it later, you can do that.
What is the recommended time frame between, like, if I wanted to do another round of injections, how long would I need to wait?
So between round one and round two, you wait 6 weeks, and then some people do 3 rounds, you would wait 8 weeks between round 2 and 3. And that's really just because your body can't keep burning that stored fat. Like the 30 days is about the limit, and then it needs a break, and then it gets settled, used to that weight, realizes maybe I don't need this stored energy, and then you can go into another round. If you were to keep doing it by day 45, you just wouldn't be losing anything at all.
And I'm starting to notice, because I was so to the letter of the diet initially, I had really good success the very first 7 to 10 days, and now it's kind of slowing. So I can tell my body's getting a little bit more comfortable. I'm still losing a little bit, maybe 0.2 or 0.4, where I was losing 0.8, 1 pound or over a pound a day. So I can definitely tell that my body's starting to not want to eat the stored fat as much as it was before.
Right.
I also noticed, and tell me if I'm wrong on this could just be me, that this is not really this is a diet you have to be in the right headspace for, because you can't cheat. You have to do strictly what the diet says.
Yeah, and I always tell people, I want this to be pretty permanent. If you're just going to do this and go back to eating McDonald's every day, or whatever, or people who have food addictions, they go to food for emotional eating, it's not long enough to change habits like that, and so that wouldn't be a good diet for somebody like that. So it has to be a commitment. I'm changing my lifestyle. Now that my hormones are balanced, I feel like I can do this. And yeah.
Right. But I will say that the 30 days of going down to 500 calories, I guess I kind of look at it a little bit in addition to my body burning stored fat for fuel, is kind of an opportunity to kind of let the digestive system rest, because you're not inundating it with so much.
Well, it's kind of like being on a detox for 30 days, right? You're eating just really clean foods. You're not drinking any alcohol, dairy, sugar, all of that stuff. And so it is a great break. And it's always interesting to me how women will say, okay, I'm glad I lost the weight, but I realized I was eating all this stuff that my body doesn't really like, or how much I was eating, or I was just eating when I was bored, so it's also just a good reminder of what am I putting in my face.
Yeah. So something that I've noticed, and there has to be a connection here, is that the ankle and foot pain that I get, and the knee pain that I get from my Hashimoto's, my autoimmune disease, seems to subside every time that I do the HCG diet. So I don't know if it's the HCG itself, or just that I'm reducing all the anti-inflammatory foods from my diet, but I always get what I think is a little remission. And as long as I keep eating clean, and it might be partially because I'm dropping some weight as well, but it happened last time, and then again this time, once I got past 12 pounds, I noticed that my ankles weren't hurting the way that they were before.
So actually they have found that HCG is really useful for chronic pain. And they also are using it to get people off of opioids, because it makes you not crave things, or you're not hungry. But yes, the pain reduction is a true thing. And I have some people who will take it 2 or 3 times a week ongoing just for the pain reduction. But it's definitely a combination, right? Losing the weight, the removing any inflammatory foods. But yes, there is some literature on the HCG and pain reduction.
That's awesome. So something else along those lines, because I know there's somebody that's a Facebook friend of mine who had asked me some questions about this, and it's something I actually need to come in and talk to you about because I need to, I've done it in the past, but is the low dose naltrexone for autoimmune disease. Mm-hmm. So some of you may not be familiar with this, but with my Hashimoto's disease, which is a thyroid autoimmune disease, Karen suggested a few years ago that I try low dose naltrexone, which was absolutely new to me. But I did have some relief from that. And then, you know, life happened and things happened and I got away from taking that. So it's something that I'll probably talk to you about doing again. But can you speak a little bit about the benefits of that? Because I think they expand beyond autoimmune disease, correct?
Yeah, and it keeps expanding. So low dose naltrexone is naltrexone, which is in the family of like Narcan. So if you were a drug addict and you overdosed, you get Narcan to survive. But we use it in very, very minuscule doses. And basically what it does is it works on the endorphin cells and it cuts inflammation, it helps the body heal, helps the immune system. It also has been used, there was a diet pill on the market a few years ago called Contrave. And Contrave was really just a combination of Wellbutrin and low-dose naltrexone. So it does have some weight loss factors with it. We use it for autoimmune, chronic fatigue, fibromyalgia. They're starting to study and use it for fertility and miscarriages, cancer, MS. So it just keeps expanding. Harvard did a study and validated it for, I think it was bipolar. But it's just a nice, I mean, there's no side effects. It's cheap. It helps you sleep good. And it's just a nice.
And it's not habit forming, is that right?
Habit forming, no,
yeah.
No.
Yeah, I didn't find that to be true, but that's always one of my big concerns is something that would be habit forming. So, yeah, I have sung praises for low dose naltrexone, and I don't know why I've gotten away from it, but definitely something I want to go back to because I think like with autoimmune disease and then the other benefits that they're seeing with it, it certainly can't hurt to keep taking it. So
yeah, I think especially after losing weight, just to keep inflammation away and keep that weight stable.
Yeah. So for women who are finding that they are feeling just less vibrant, they're missing their old self. You know, I hear that from a lot of women. Like, I just don't feel like myself. I wish I had my old self back. Some of the things that come along with perimenopause and menopause as our hormones start changing. I think some people are just a little bit overwhelmed. Like, where do I start? What do I do? You know, so what would you say to them?
Yeah, well, I always say my favorite compliment when in my practice is when people come back and say, I feel like myself again. Because it is very upsetting. And a lot of people will come in and say to me, like, is this it? Like, I'm 50 and this is going to be how I am for the next decades. And so I always say, like, this is more than just hormones and getting through menopause. This is the quality of life you want, how you age. You know, as women, we're kind of the first era that nobody's shocked if a woman's 108 anymore. So, but we're still going through menopause about the same age, around 50, 51. And so how do you want those decades of life to be? You know, hormones are kind of the essence of life. And when we lose them, we really start to age. So, and unfortunately, so many women come to me and they've been told by their primary doctors that, you know, sorry, there's not much I can do for you. You know, too bad you're a woman, here's an antidepressant. And so I think it's just, you know, doing some research, and there's a lot of providers out there that are opening their eyes to it. I mean, for the last 10 years, every medical conference I've been going to has been saying hormones are fine, but it's just not trickling down to primary care practices and stuff.
Right.
And there's a plethora of research, but I just feel like it's being ignored, or maybe because a lot of it's being done in Europe and Australia and stuff now, so it's not in the US, it doesn't get the same attention. But you know, you just have to be an advocate for yourself, and if you're not feeling right, you've got to find the answers. And that's honestly, when I opened my practice, I thought it would take a while to build up because I was cash practice, and people just came in and threw their credit cards at me and were like, just fix me, I'm sick of being told my labs are normal but I don't feel right.
Yeah. And, you know, I think that's one of the things that I was so impressed with you about, because I feel like I've really researched the thyroid far beyond what most people would. And, you know, we connected on that because you knew I knew what I was talking about. And I knew that you knew what you were talking about, where, you know, the normal range for TSH, like that is such a garbage, baseline for whether, your TSH is normal. Well, we know that it goes far beyond TSH. It's your free T3 and your like all of those things. And not only that, the normal range for TSH is so crazy broad that I just don't think you could fall into normal and feel miserable, and it just gets dismissed as, well, you're normal. So I was always very impressed with Karen, because you know that, and you know that there are all these other labs that need to be looked at to really determine if the thyroid is working properly and not just TSH. So that's something that I really respected about her, because for years I'd been trying to find somebody that would listen to me, having to beg, like, please give me some Cytomel, I need some T3, I know that I need that. And eventually I got that from a primary doctor, but I literally had to kind of force it on them, where when I saw you, one of the very first things you said is, well, what's your free T3? Like, you knew immediately that that's something that we needed to take seriously, where I'd spent literally a decade trying to get somebody to test me for that based on my own research. So I think, there is a lot of stuff that, and it's not that I fault primary care doctors, I just think that's not their specialty. And, they're kind of just trained to look at things through a certain lens, where you're looking at things through a much different lens.
Right. Like, my normal ranges are more like what's optimal health versus, well, you fall in the normal range, which that doesn't mean you are healthy and happy. It just means you fit their category of normal.
Exactly. So Amy says, let's see here, so much great information during this time. You've given me much to think about. And that's awesome, because I think, one of the things I wanted to have everybody take away from this was that we kind of have to throw away some of the things that have been beat into our brains about the dangers of hormones, because like Karen spoke to, that, by 50, we're starting to go through menopause, we're losing these hormones, which you said by definition are like the essence of life. Is that kind of what you had said earlier? I thought that was just a great quote. And then we have the second half of our life that we don't want to feel miserable or start to decline in health or start to have these problems associated with the loss of hormones. Karen, is there anybody that shouldn't consider bioidentical hormones?
No, maybe there's, like, I've had patients who've had blood clot and stroke, so I just for their comfort wouldn't use estrogen. But you can still use testosterone. One of testosterone's roles is to kill off breast cancer cells, so it's a very beneficial hormone, progesterone usually. And even if you can't use hormones, there's other things like, let's make sure your thyroid's optimal. I can get the majority of hot flashes resolved just by getting adrenal glands balanced or your cortisol levels balanced. What's your growth hormone level? So there's always a workaround to make you feel well.
Mm-hmm. And I know, so since I first started seeing, or since I saw Karen post hysterectomy, I know we talked about this, but I lost a lot of hair. Having gone through that, I think the shock of surgery itself, but then also the hormones plummeting. I've always enjoyed having long hair, and I just had hair coming out in clumps after my surgery. And so at one point, without even having a haircut, it was like kind of up to my shoulder. And I think, with Karen's help with the hormones and whatnot, it's grown back really nice. It's taken me a couple of years, but we do the hormone pellets, the estrogen, testosterone. You also send me home with some really great natural supplements. And I think like the combination and the cortisol and the combination of all of those things have helped me get back to feeling like myself, but also the hair growth and my skin feels better and all of that stuff.
Yeah, definitely. Yeah.
Yeah. Does anybody have any questions for Karen before we end the show? Karen, thanks so much for being here.
You're welcome.
I want to share Karen's website, and then if anybody has any questions before we go, you can get her at essentialhealthllc.com, and then the phone number is 608-729-8778. And anything else, Karen, that they should know as far as how to best get a hold of you? That was like, go through the website, call by phone and make an appointment.
Yeah, that's probably the best. I'm terrible at my Facebook, so don't even go there.
And then Jill says, thank you both. You're welcome, Jill. I hope you found it useful. And Karen, thanks so much for being here. I look forward to seeing you next time.
All right, sounds good.
All right, thanks for taking time out of your busy schedule.
Bye.
All right, see you later. Bye-bye. Okay, you guys, thanks so much for being here. As always, remember to be good to yourself and to others, and I will see you next week for Weight Loss Wednesday. And if you would like, we are going to review some Paracone MD foundation this Friday for Foundation Friday, and that'll be at 8 p.m. this Friday. So you guys have a good night, and I will see you next time.